Nutritional deficiencies, link with cognitive and social development among infants and toddlers, was the topic presented by Professor Maureen Black during the NNI Symposium at the 29th International Pediatric Association, or IPA, Congress 2019. Maureen Black is a professor of pediatrics at the University of Maryland School of Medicine and Distinguished Fellow at RTI International. Toddlerhood represents striking changes in children's development. It is a time of rapid cognitive, social-emotional, and physical development. Nutritional deficiencies during early life can have an immediate impact on cognitive and social development, with consequences that extend over the entire life course and may also affect the next generation. In 2010, 249 million children under 5 years of age living in middle and low-income countries did not reach their developmental potential due to stunting and poverty. As shown in the map on the screen, most of these children live in Africa and Asia. Stunting, a visible sign of undernutrition, and poverty are intertwined. Stunting, which is low height for age, is a potential marker of long-term undernutrition and is often present at birth in middle and low-income countries. Stunting, especially when occurring in the first 2 years of life, impairs growth, cognitive development, economic productivity in adulthood, and can also affect the next generation. Long-term effects of stunting include reduced developmental quotient in the next generation. Toddlers and young children of mothers who are stunted themselves between the age of 9 and 24 months had impaired developmental skills in cognition, hearing and speech, hand-eye movements, and locomotion in comparison to those whose mothers were not stunted during early life. Micronutrient deficiencies, another form of nutritional deficiency, are predominantly related to poor diet quality, such as diets low in fruits and vegetables. They are less obvious because they do not necessarily impact growth. Iron deficiency is the most common nutritional deficiency globally. Iron has a substantial role in the brain development of infants and toddlers and aids in the transport of oxygen to the brain. Iron deficiency is the primary cause of anemia. Iron deficiency anemia in infants and toddlers less than 2 years of age is associated with poor cognitive development. Improved iron status of at-risk infants has been shown after maternal iron supplementation, delayed clamping or milking the umbilical cord, and early iron supplementation, especially during the critical period of late infancy, as mentioned by Professor Black. However, there is still concern about iron supplementation, especially in iron-sufficient populations. Food insecurity, a state of being without reliable access to sufficient quantities of affordable and nutritious food, is a driver for micronutrient deficiencies. As a response to food insecurity, the quality of foods consumed will often change. The consumption of high-protein foods, such as eggs and meat, and fruits and vegetables decreases, while those of less nutritious foods, such as noodles and other starch-containing foods, increases. Feeding behavior is possibly another link between nutrition and cognition. While a direct effect of nutrition on cognition is well established, feeding behavior, that is responsive caregiving and feeding, also plays a role. Responsive caregiving and feeding is characterized by providing clear but not harsh directives and feedback, being caring, and having consistent, predictable routines such as consistent mealtime routines and contingent responses. One important goal for responsive feeding is to enable the child to self-regulate hunger and satiety, given that many children grow up in an environment that favors overweight and obesity. Responsive feeding includes bidirectional concepts of interactions among the baby and caregiver, during which the parent or caregiver listen to baby's hunger and satiety cues, has trust in the baby, encourages its autonomy and self-feeding. As an example, when the baby whines, signaling hunger, the caregiver offers vegetables. When the baby opens the mouth, the caregiver feeds a bite. When the baby fusses, instead of putting the baby under pressure to eat, their caregiver smiles, offers finger food. The baby smiles and takes the veggie and eats. What are the recommendations? Professor Black pointed towards 3 major aspects. Ensure nutritional adequacy and the avoidance of other forms of early adverse experiences. Ensure nurturance and responsive caregiving. Initiate interventions early in life. In a nutshell, apply nurturing care which promotes early child development. Nurturing care includes adequate nutrition, good health, responsive caregiving, security and safety, and opportunities for early learning. Please click the link on the page to see Professor Maureen Black's full talk